Hi, it's Susan Ketterer with Susan Ketterer Consulting. Thank you for watching my YouTube. This is a tip for the day, and if this information is helpful for you or you think it would be helpful for somebody else, please do be sure to share it. Today I'm going to be talking about listening, and it's not necessarily about you listening, but I'm going to turn the tables around, and it's going to be about the patient listening. And it's very important to make sure you have answered every last question for a patient before you sit down at that consultation appointment. Because when they're in that consultation appointment and all the questions are not answered, what are they going to be thinking about? They're going to be thinking about, oh my gosh, is he going to talk to me about this, or I really don't know, and they're going to be having that adult voice that you hear on Charlie Brown, that wah 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 wah, and they're not going to be listening or hearing the words that you're saying to them. And the take the time to make sure you're answering questions and collecting information at that new patient exam so everything's ready to roll when you're at that consultation. But it's always important, getting at a Twitter message right now. Anyhow, make sure that you are asking them when you're sitting down, Mr. or Mrs. Smith, I have taken the time, I've collected all the information, we've put together a comprehensive treatment plan for you. Do you have any questions before we proceed? Isn't that much better than... Okay, so I'm going to talk to you about your periodontal disease, and then we're going to talk to you about all these bad things about you, and by the way, this is how much it's going to cost. So make sure you are presenting a question at first on, are there any questions you have before we begin? That will bring them at ease, that'll bring them at attention. They're going to listen to what you have to say a lot better when all of their questions are out of the way, tucked away into the cabinet or wherever they may be, and you're going to have a much better acceptance rate if they're really engaging and listening to what you have to say. So try it out. This is my tip for the day. Susan Ketterer, thank you for listening.